Alrighty, we'll get started. So welcome to the Georgian Fahey Center for Healthcare Innovations 2023-24 Patient Engagement Lunchtime Learning Series. I'll just start us off with a few housekeeping items. So this series is accredited by the Royal College of Physicians and Surgeons of Canada as a group learning activity, and it may also be eligible for credits towards requirements of other professional bodies, such as the College of Pharmacists of Manitoba and the College of Registered Nurses of Manitoba. Please note that for the lecture portion of this session, participants will be force muted and video is turned off. We will re-enable this feature during the question period at the end. The chat will also be restricted to sending messages to myself, the host, and our co-host as well. We have time for discussion and questions at the end, but if you are welcome to also submit a comment in the chat at any time. To use the chat box, click the chat button at the bottom of your screen and enter your text where it says type message here. If you have any trouble with Zoom, please feel free to message me directly at any time. We also have auto transcription enabled, so you should see closed captioning for this session. If you want to toggle this off or on at any time, you can do so using the caption button at the bottom of your screen. We will also be sharing a recording to our YouTube channel of this session, and the slides will be available on our SlideShare account. The links to these will be provided in a follow-up email after this event. And now I'd like to welcome back our speaker, Carolyn Shimon. For this session, she is the Patient and Public Engagement Lead at the Georgian Fahey Center for Healthcare Innovation, which is Manitoba's Strategy for Patient-Oriented Research, or SPORE, support unit. In this role, she is responsible for all patient and public engagement in health research programs and services that are offered at our center. So welcome back, Carolyn, and please go ahead and start whenever you're ready.
Thanks so much, Victoria, for the introduction. And thanks to everyone in our audience for joining us today to learn a little bit more about budgeting for meaningful patient and public engagement. And so I'd first like to start off by acknowledging that myself, Victoria, and the Center for Healthcare Innovation are located on the ancestral and current day lands and waters of the Anishinaabe, Cree, Ojibwe Cree, Dakota, and Dene Suline people, and on the national homeland of the Red River Métis. And in northern Manitoba, we acknowledge the ancestral lands of the Inuit and gratefully acknowledge that our water is sourced from Shoal Lake 40 First Nation. And in coming together today, as we learn along this journey of engagement, we respect the treaties that were made on these lands. We acknowledge the harms and mistakes of the past. We recognize the ongoing present day colonial violence that is faced by Indigenous peoples within healthcare, education, justice, child welfare, and government systems. And we dedicate ourselves to moving forward in partnership in a spirit of reconciliation and collaboration. And again, when we talk about patient and public engagement, community engagement, it is in fact Indigenous research methodologies and scholars and students and communities that we should be looking to. And we also believe that when we're talking about patient and public engagement, it has to be grounded in a social justice and health equity approach. So just a little bit of an overview of the learning objectives today. So we're hoping by the end of the session, we should be able to identify key considerations when we're creating a budget for patient and public engagement, to be able to access and use CHI's patient engagement budgeting tool, and to develop a draft budget that can be attached to funding applications as we go along. And so just to ground us, because sometimes it's good just to start off with what we're talking about when we're talking about patient-oriented research and patient engagement. The Strategy for Patient-Oriented Research, which is a national initiative here in Canada, defines patient-oriented research as a continuum of research that engages patients as partners, that focuses on patient-identified priorities, that improves patient outcomes, that's conducted by multidisciplinary teams in partnership with relevant stakeholders, and it aims to apply the knowledge generated to improve healthcare systems and practices. So when we're talking about patient-oriented research, it encapsulates um, all of these parts and components. And so when we talk about patient engagement, the Canadian Institutes of Health Research, the strategy for patient-oriented research really define it as the meaningful and active involvement of patients in the governance of research. So sitting on all levels of governance, so your operations, your steering committee, your data safety monitoring committee, but actively making decisions around the research process. So identifying the research question that should be asked, the priority area, the outcomes that you want to look at, um, helping in the co-design. So what methods should we be using? Helping in the interpretation of findings, in the knowledge translation of findings and implementation. So all the way through having a say in the decision-making process. So priority setting of research and then conducting. So we do have examples of people with lived and living experience really being actively involved in as co or peer researchers, helping even do things like perhaps interviews or running focus groups, and getting that richness of data when a peer is involved. And then in the knowledge translation of research, so really helping to craft how to move research into action. And of course, when we talk about patient and public engagement, and this is a good thing to keep in the back of your mind as we start going into budgeting as well, is that there's a number of levels to engagement, right? You probably have heard that before. So at the consultation level, which is considered kind of the lower level of engagement, we're really looking to obtain feedback and input around decisions throughout the research process, but researchers still kind of maintain the final say. Whereas when we move into collaboration, we're really talking about shared decision making, which means we're going to be using some participatory approaches to meet people where they're at and work together to share the decision making power. And then when we talk about patient or public or user or community directed, we're really talking about people with lived and living experience, caregivers, families, and community members actively actively kind of managing and overseeing the research process. So making all of the decisions, and the researcher's job is more taking direction from community members around and bringing their research expertise to the table to carry out some of the research process. And of course, with every different type of level of engagement, there's also different types of participatory approaches. And this is really good to consider as you're building your engagement strategy, which also then involves building your budget around it so that it's comprehensive and looks at the type of participatory approach you want to do and the level of engagement. So considerations for engagement. We typically recommend, and this is really the thing that we start off with before we build our budget, is really assessing expectations and willingness to engage. So first of all, having a heart-to-heart internally with some of the other researchers who are going to be involved around the level of engagement, that first of all, if you have, say, a grant where collaboration is really important, then understanding that this is the required level of engagement, and really talking about how the research team believes that engagement will improve the outcome of the research, the potential. So where are all the opportunities for people with lived and living experience to help inform and share decision making? Is it outcome measures? Is it in the interpretation of findings? Is it throughout? What is the likelihood the research will fully consider partners' input? So really thinking about how flexible you are around decision making. If per se people with lived experience or caregivers have a different idea on the design or the way in which the outcomes that we're going to take into account, and then what resources are likely to be available to support your engagement. And this is when we start thinking about how we're going to budget and make sure that those resources are present. And then externally, it's really important to have conversations with people with lived and living experience before even engagement, right? Going for coffee, talking with community members, and having an understanding, first of all, of previous history of engagement. So really understanding what types of research and engagement have been done in the past, uh, what and taking that into consideration when you're planning your engagement. Also, having a good understanding of what inequities exist in relation to the health issue that you're researching. So, who is affected differently? Who has different access to services? And when we talk about access, we mean not only geographical barriers, so thinking rural versus remote, or urban and rural, um, but also thinking about systemic barriers to healthcare, right? People facing racism, colonialism, ableism, sexism, transphobia, homophobia, xenophobia, all of these different things, and really considering how that might impact people's access to services. Where along the patient journey are the people that you want to engage? So considering those types of things, for example, if you have people who are newly diagnosed versus people who have lived for a decade with a health experience, it might mean as you talk to people, having a few different groups, because maybe newly diagnosed want to talk to or want to be engaged with people who are newly diagnosed. So really having an understanding of the journey and where you're seeking to engage. And then really thinking about how I'm going to ensure a diversity of perspectives are included. And this has an impact on your budget, as far as sometimes when you have conversations, you'll find out some people would prefer to be engaged in a group, some people would prefer to be engaged one-on-one. And so really trying to think about ways to ensure that you're getting that diversity of perspectives, which might mean you have to plan out multiple engagement activities or multiple avenues for people to be able to contribute to research decision making. And then asking people about their values and expectations. Where do people expect to be engaged? If you have people with lived and living experience really wanting to engage at the collaboration level, but researchers are only at the consultation level, navigating that conversation and having an understanding and being very clear with your communication is important. And then how would people prefer to be engaged? It's always great before you start building your engagement budget to have a good understanding of how people would prefer to be engaged. So then you can really think out all of the different resources that you might be able to, or the resources that you have to think about in order to be able to engage inclusively. And we have some resources that you can take a look at. We have a readiness to engage workbook that has some questions, both for people with lived and living experiences, researchers, stakeholders, rights holders, community members who are coming together, questions to go through first individually and then as a group. And we also have our methods of engagement, which process maps all the way through every phase and stage of the research process, the different levels of engagement, and then it gives you some suggestions around participatory approaches as well. So what types of supports need to be put into place to ensure that we're doing inclusive and meaningful engagement? First of all, if anyone's heard us talk before, I always start out with our belief is that two of the big key things that need to be in place is both a commitment to critical reflexive practice, both as researchers, as partners, that everyone commits to this kind of ongoing reflection around their own social location and how that informs the way they view a health issue, the way they interact, and with one another, and really commit to that ongoing conversation. but also trauma-informed practice. So when you're thinking about your engagement strategy, putting into place certain elements that enable people to feel safer when they are doing engagement. So that might mean having budgeting for extra meetings in order to ensure that there's time for relationship building and those types of things. So these are really things to think about as you're going along your journey, building your strategy and building your budget for engagement. So really, when we're thinking about key considerations around your budget, they almost kind of drop into these 5 components. So first of all, you want to think about your recruitment strategy and what you might need to meet people where they're at. We always encourage people to think outside of the box because, as we were talking about before, we want to engage people who may not have the same access to care. We want to engage people who may not uh, perhaps see the opportunity through regular modes like, say, advertisements in a newspaper, or a physician or clinician researcher identifying patient partners. Maybe it's also building community partnerships and relationships and trying to get the word out in a multiple variety of ways, which you might have to think through as far as your budget. Time and energy and out-of-pocket expenses. So really thinking about all the people you want to engage, and think about the time and energy that you're expecting people to come to the table and give, making sure that you compensate people with lived and living experience for that time, and then really thinking ahead of time about any types of out-of-pocket expenses so that they're not out of pocket, that you have things on hand to support people, to readily support them, to be able to fully contribute to the research process and to that engagement. Accessibility, really making sure that the spaces in which you want to engage are accessible, the technology that you're using, the way in which you're engaging, that you've thought through how to ensure that everyone can equally meaningfully contribute. But also, as we were saying too, as far as trauma-informed approaches, also thinking about how you're developing your strategy, and what relationship building, what kind of elements might be really important to the relationship building process. And that might be having meals together, having some extra meetings where you're just building relationship before you even get into the nuts and bolts of your research project. So really thinking through how you want to ensure that space as well. Capacity for involvement. So really thinking about building into your budget, training opportunities, conferences, those types of things, and then always having in the back of your mind social and historical context so that you can build an engagement strategy that acknowledges past engagement, and also thinks through how to build those relationships and what that might entail. Now we're going to get into it all. So budgeting for engagement. First of all, compensation for time, energy, and expertise. We are firm believers of compensating people with lived and living experience because they bring an experiential knowledge to the table and to the decision making around the research process that cannot be accessed by anyone else. And so they bring a unique expertise to the table. And therefore, we want to think um, about building in your budget compensation for folks. So if you look at some of the different guidelines from the Canadian Institutes of Health Research and so on, there's a number of ways in which you can compensate people with lived and living experience. And that can start with the fixed service income. So that means that means when we're thinking about hourly or daily rate, we do know some SPORE networks have come out saying kind of a minimum of $25 per hour. And that takes into consideration thinking about living wages and thinking about all that's brought in. Some researchers pay more than that. And so really considering that. salary or stipend. So that's not based on hours, and it may, oops, sorry, I am moving around here. And it may adhere to institutions' practices. So this is when you do want to talk with your institution's HR, perhaps, to really have a better understanding of how that would work. There's honoraria as well, so voluntary one-time payment made for services, which fees are legally or traditionally required. So thinking about, say, if you're doing a one-time workshop, so a set kind of amount, or a speaker, having speakers with lived experience, all of those types of things. If it's kind of a one-time bit, you might be looking at an honoraria. And then also thinking about in-kind payment or gifts, so acknowledgement of contribution that is beyond beyond monetary. And so some of the considerations that we always have around compensation is, first of all, having those conversations one-on-one with partners, so not as a group, but rather giving all the information ahead of time about the payment options, and giving people with lived and living experience the opportunity to explore those different payment options before engaging. Think about contacting your institutional finance, your HR department. We've even had things around ethics as well to provide specific advice. So involving them early can help things out. Um, Really letting people with lived and living experience know about the potential financial impact on EI, on disability income, and different ways that you can offset it, but being very clear in advance about those potential impacts. You can provide information on how to access some of the CRA guidelines, but also we always keep here in Manitoba a list of free tax services in the area. If we're not able to answer a question, then there are places that people might be able to act just to have some confirmation and find out about that. Um, and thinking about different payment styles and amounts for members who face systemic barriers, thinking about consistent payment rates through the institution, and then really discussing those options individually, as I was saying before, with partners. Transportation. So this is another one to think through and really have conversations. So transportation can be anything from um, having bus tickets ready to go, having set up some set up ahead of time with taxi services to go and pick people up and drop them off and have it charged directly to you, so people don't have to be paying out of expense, paying for flights if you're engaging people in rural and remote situations, trains, all of these different things. So thinking through the transportation requirements, mileage, having parking passes available if you are going to engage, and there's parking fees, having those passes available, right? So nobody has to go out of pocket for their engagement. Yes, there's the parking fees. Very important. We typically try to strive to engage in areas where there are no parking fees, but you may come up against it at some point in time. And it's really important to think through and have those things available in advance so people don't have to be out of pocket. Caregiving. So this is, you may have people with lived and living experience who have children, so they might require a babysitter or a caregiver. We also have people with lived and living experience who are caregivers for adults, and so thinking about paying for the time of a caregiver to come in to help so that a partner can really fully engage and contribute to the conversation, respite, all of these things. So thinking through that, having conversations with people. Accommodations. So making sure, one of the big things we also do is for accommodations, it's really important to double check. We sometimes have hotels that say they're accessible, but then when we go through, they're not as accessible as we thought. So really doing your research in advance to make sure that the accommodations that you are paying for people to come to are accessible and meet the needs of the people with lived experience that are being engaged, but always making sure those things are paid in advance. Even sometimes having a credit card for additional expenses available as well, so people don't have to pay out of pocket, or that you may be engaging people who don't have credit cards. So really thinking through all of those pieces. Food and beverage. Everybody's been at a meeting where they're hangry, right? So we we really encourage food is something that we've been told time and time again when we are engaging with people with lived and living experience, the importance of having food and building relationships as we eat together. And so if you're having a smaller meeting that's kind of less than 2 hours, having some just healthy snacks and beverages, but always if it's a longer meeting, then really making sure there's a meal with that as well, and having time to eat that meal too. So thinking through those. Also having conversations and making sure that if people with lived and living experience have care attendants or caregivers who also um, who also are going to attend your engagement event, that you have payment for them for their presence as well as thinking about food and refreshments and those things. And even from a trauma informed approach too, there may be times where people with lived and living experience would feel more comfortable engaging by bringing a family member or a friend with them, and kind of keeping that open door policy and being able to have food and refreshments for those people as well, and transportation. Also thinking about translation and interpretation. Really, to have meaningful and inclusive engagement, we have to think about engaging people. Um, English is not the first language, and really thinking about, first of all, translation, so written language, so making sure that all your materials have been translated, and then interpretation is spoken language, so thinking through how many interpreters you might need in advance, and looking at the costs of those, and thinking about translation services and whether you might need some materials, and budgeting for those types of things. Technology, we want to make sure that everyone has equal access. So if you are doing online engagement, there are times where people may require some technology, some tablets or laptops or screen devices. So thinking about those types of things, but also thinking about e-readers and different ways in which people can actively engage online, and making sure that those are accessible to people with lived and living experience. We've even done things paying for Microsoft Word and those types of things for people's computers so that they can fully engage. Accessibility we spoke about, but that's really thinking through where you're holding any type of in-person engagement event. And online, of course, we've done before, where if someone doesn't have the technology to engage and it's an online engagement, really talking to community organizations near the person with lived and living experience, that you might be able to get a room with a computer that they can come and use, and so booking out that time. So thinking through how to ensure ahead of time that everything's accessible. Printing, so budgeting for printing materials out. Nobody should ever have to print materials out on their own who are engaging. So if you so really factoring in that the printing costs for materials so that people can actively engage in advance. Also factoring in support, so whether it's elders, knowledge keepers, counselors, making sure that those supports are budgeted for and are available for people with lived and living experience. So that is also a consideration. And really, when you're doing your external assessment, talking to people about what would make their engagement better, what type of supports might be really important for them, in coming together. Sorry about that. Gifts. Sometimes it's great to start engagement with small gifts for people. We also do gifts sometimes of appreciation at the end of an engagement. So thinking through those little things that show appreciation as well. And then professional facilitators. There may be times when you're engaging where you feel more comfortable hiring a professional facilitator. We've had clinician researchers where if it's kind of a rare disease and they're engaging people with lived experience who are actually their own patients, they prefer to have a facilitator out there. Or we've had times where we're doing engagement and there's just one research decision where researchers acknowledge I'm pretty biased around this and I might sway people if we have if I'm the one leading the conversation. So then they put in place a facilitator and pay for a facilitator to come in and just help with that particular decision. Conferences and capacity building, just like researchers and students, where you factor into your budget conference registration, accommodation, and transportation. It's good to think about opportunities for people with lived and living experience to also attend those conferences, to present, to be there, to build capacity. So really thinking about factoring that into your budget in advance, just as you would when you're putting in a larger grant application. So now we're going to take a little bit of a look at our downloadable budget builder. It's an Excel file sheet that helps you calculate your engagement budget. And it was co-developed with researchers, KT and patient engagement, so knowledge translation and patient engagement practitioners, and also community public patient partners. It's continually updated based on users' feedback. We have another version coming out soon. And it actually provides you, there's a number of tables, but it provides you with a really nice summary table that's formatted so that you can copy and paste it and include it in grant proposals. And we do have a how-to blog that we've put a little link to, and we put our link to the tool as well. But what I will do is stop sharing this, and then I will bring up our nice little budget builder. There we go. There. So this is what the budget builder looks like. It's, yeah, as you can see, it's a lovely Excel spreadsheet. But at the bottom, you actually have these different tables that can help you go through your budget. So to start off with, we have some preliminary questions. So if you thought through number of meetings, how many meetings or gatherings do you intend to hold with patient and public partners? So say we're thinking about, oops, just a second, I will make sure that I can, sorry about this. Just, oh, sorry, this is me. I will bring back our budget builder. There we go. Is it letting me? Oh, goodness. Sorry, I'm having a little bit of trouble. There we go. It's not letting me. Okay, we're just going to scroll through if that's okay. So first of all, ask you the number of meetings that you're thinking about. So how many are you thinking how many meetings are you thinking about having? And so this is where you can really think about, do I need a few pre-meetings for relationship building and so on, and factor that in. And so you can put in the number right there. And then duration of meetings, it'll ask you how long do you expect each meeting to last? One thing I think about when I think about the number of meetings, I think about how many research decisions people with lived and living experience can be actively engaged in. And then I typically say one meeting per decision. So that allows you to use a participatory approach to have fulsome conversation around each decision. And it gives you that amount of time. So I typically, if there's 6 or 7 decisions that have to be made, making sure that I have that number. And then attendees, they'll ask you how many people are you thinking about inviting? And then, and that's how you can always factor in, are you doing an advisory group? Are you engaging people one-on-one? Really thinking about how you might engage folks in that way. And then when it comes to the engagement, how much will you compensate each patient or public partner? And this is where you can go to our compensation builder. So it's a separate page, but it will fill in the main, but it'll fill in your main page and the budget overview as well. And so, first of all, making that decision around whether it's going to be a fixed service income. So, how many patient partners will be receiving an hourly compensation, and then how many hours, um, or what is the hourly rate of compensation? So, say they recommend $25 an hour. Doesn't that work? Oh, it is. Sorry. So, $25 an hour, and you have 3 partners. Or no, 7 partners. So that's, you would put in how many partners and what the hourly rate would be. Because if you remember on the other page, we've already talked about how many meetings and how many hours. There's also a space if you're thinking more about honoraria or one-time payments. How many patient public partners will be receiving an honoraria, and then how much is the honoraria? In-kind compensation, so thinking about how many partners will receive that and what the estimated cost per person, whether it's a conference fee, it's a course registration, including accommodations and travel. So really thinking through that. And so then that is filled up into our little budget builder. And then you can move on to costs of engagement. And that can be how much, oh, so that's the compensation. So you can think about refreshments and beverages. So thinking about how many people you're going to have at a meeting and thinking about how much you might spend or have allocated for food and beverages. Facilitation, are you thinking about having a facilitator, and what is a typical, taking a look at what the facilitator's hourly rates are. Support services. So this is where you would put, if you have an elder or a knowledge keeper or even a social worker or a counselor that you want to attend, perhaps people with lived and living experience have identified someone that they would like to have present for the engagement. So having an understanding of making sure that you know how much the cost is and putting it in there. For communication, again, this is if we need an interpreter or translator, so spoken words, sign language as well, are required for people to be able to fully participate, and then putting in the estimated costs of interpretation services. Caregiving, are there people with lived and living experience who may need someone to look after children, or for to have some respite care or caregiving for an adult? Transportation, again, you can put in how many people in your group will need taxi services, a bus, mileage, and putting that into there. And then from there, we can take a look at, and then we have travel. So really thinking about how many people might be traveling from out of town and what types of assistive devices or care attendants they may require as well. And we do have an inclusivity and accessibility considerations list as well, which has the interpreters and translators question and the hourly rate, childcare and caregiving costs, again, that you can put through here. The cost for travel from rural and remote. So it talks about airfare prices, how much for accommodation, how many nights is someone going to require the accommodations, and so on. And you can think this through. I know if you're applying for a grant, thinking through this and giving some numbers that you have a rough idea of is really good. Will someone require a travel companion? A lot of times people don't want to travel alone, so having paying for those costs as well, and for the travel companions. This is a really interesting one that we don't always think about as well. Making sure that patient or public partners who require health insurance for travel purposes, that's also considered in your budget, to be able to cover that, because not everyone has access to that. And then the estimated cost for that health insurance for travel purposes as well. And then also thinking about care attendants, and or support workers who may come with someone, thinking about assistive devices to enable people to be able to fully participate, and then total costs for accessible formats for meeting materials, so things like large print, plain language, e-readers, those types of things as well. And so those are the meeting. Oh, and then we can go on to the venue. So thinking about the meeting space that you're going to meet at, audio and visuals, always important. Transcription, if you are having transcription um, services available, and thinking about those as well. Print costs, any additional, under additional meeting costs, you can also have things like gifts for visiting speakers, tobacco for partners, making sure that you have thought through these as well. One-time costs, this is where you can kind of add any of those additional one-time costs that you think might be incurred. Recruitment posters, advertising, research and administrative staff, engagement coordinator, software licenses, those types of things can be added here. And then we always recommend a contingency fund, because we know engagement can be unpredictable at times, right? And we might need some extra funds. So between 5 and 20% for your contingency. And then you get this beautiful copy and paste. It'll calculate it all out for you, budget overview that you can then attach to your grant application, which I know I've been told is very useful by a lot of researchers. And I'll stop sharing and bring back that piece. There we go. Oh, sorry. From the current slide. And so one thing that we also like to mention is, in addition to thinking through your budget and to monetary pieces around engagement, there's also additional ways you can show appreciation, by offering training and skills building opportunities. Things like having a dedicated workspace for partners, with access to a computer, a printer, a scanner, internet connection, is also a way that you can show appreciation. Really thinking about co-development and presentation or co-authorship, helping people get ready for a presentation, involving partners in meetings with decision makers, making sure that you regularly touch base with people, go for coffee, have those conversations, and really communicate back the impact of engagement. We oftentimes do certificates of appreciation, highlighting partners' contributions, offering reference letters for work or school or other activities, nominations for awards or features on local news, documenting and sharing back all the different contributions your partners have done, featuring partners in internal or external communications, helping partners with adding the contributions that they've made to your research project on their own CVs and cover letters, showing up to support community events that are really important to your partners, or volunteering for events, showing up for important events to your partners if they are presenting somewhere, or receiving an award, showing up for those things. Setting time aside to build that relationship and have tea together, holding meetings at community centers that are really important to partners, so thinking about those types of things, inviting partners to staff networking or engagement events, sending cards for birthdays or special occasions or just a thank you, and then just regular communication. So even just touching base with partners. So those are additional ways. So we always believe in compensating partners and making sure that we budget for meaningful engagement. But these are just ways in addition to that that you can also show your appreciation for people's engagement. So some of the additional resources, and I think these slides will be accessible to you. So you can look through the CIHR Patient Partner Compensation Guidelines. CIHR also has considerations around when paying patient partners in research. The SPORE Evidence Alliance has a nice patient and public partner appreciation policy and protocol. And then there's also the Canada Revenue Agency guidelines and free tax services that are always really important to have on hand as well when you're having these types of conversations. So I will open it. Sorry, that was a lot of information, but I will open it up now to questions.
Thank you, Carolyn. I'll go ahead and stop the recording.